introducing the speaker of this session. The first speaker of this session is Dr. Qasid Ahmad Bajwa. He is from the AMC, Amiruddin Medical College, Batch 3. He is also my class fellow, and he is also joining with his partner, Dr. Fizzah Zubair. We are grateful for both of them that they traveled just to attend this seminar, and they came to Pakistan like 3 days before. They have a lot of family commitments, a lot of other commitments, but they join us here and stayed here for you. They will be explaining you the UK pathway along with the Dr. Nukhaiz Sheikh. Might be joining us online, Dr. Faik Masood. He worked in the UK system, but he currently matched into the United States. He's back here. He will be joining us. And lastly, the Dr. Umar Arif. So please give a big round of applause for Dr. Qasid Ahmad and Dr. Fizzah Zubair. Thank you so much.
Good afternoon. My name is Dr. Fizzah Zubair, and I'm currently working as a resident doctor at Scunthorpe General Hospital, United Kingdom. I am from Amiruddin Medical College, 2013-2018 batch. Before starting this presentation, I would like to mention that whatever information I'm going to present here is taken from a website, Journal Medical Council. Journal Medical Council is just like PMDC in Pakistan. So it is a public designated body which keep the register of the doctors who are registered to work in the United Kingdom. So if you go to their website and if you search how you can be a member or how you can be registered as a doctor in United Kingdom, then it gives you a very good step-by-step guidance on what to do and how you can further excel. Moreover, at the end of this session, all of you are more than welcome to come to us for one-to-one mentorship, and we can always dig into any section which you want to further know about. So the learning outcomes we are aiming from this presentation are, wherever you are at the moment in your life, whether you are actually eligible to pursue the UK career pathway or not, what are the exams you need to give, what would be the expenses which will be coming while you will be in the United Kingdom to give your exams, what you can do to enhance your CV, what are the alternate routes to get the membership apart from PLAB route, what are the training pathways, how is life generally in United Kingdom, and before you graduate, before your graduation, what you can do during your medical school to enhance your CV and to make sure that you excel in your pathway. So first of all, eligibility requirement, you need a primary medical qualification, which is an MBBS, which all of you will be getting after your final year exams. You need to show them that you have got appropriate English language skill by giving in exams. There are multiple exams, but the most common one are OET and IELTS. You can give one of them, and then you give them the proof that this is my medical qualification, which is MBBS, and this is the English language competency exam I have passed, and then they give you a thumbs up to go ahead to book for their clinical exams, which are PLAB 1 or PLAB 2. These English language tests are valid up to 3 years, so you have to apply for the exams within 3 years after passing these English language tests. So PLAB is, as I mentioned, is an exam which assesses your clinical knowledge that you are safe to work in the NHS in United Kingdom, and it consists of 2 parts, which is PLAB 1 and PLAB 2. PLAB 1 is a written exam which consists of 180 MCQs. You have to answer them within 3 hours. Each question carries 1 mark. It happens 4 times in a year in different parts of the country. In Pakistan, it is happening in Karachi or in Islamabad. And you have total 5 attempts, after which you cannot go for PLAB 1. Once you have passed PLAB 1, you have 2 years validity, within which you have to apply for PLAB 2 to go ahead in your pathway. The rechecking is not allowed for this exam. However, you can appeal if you get any administrative problems while performing for the exam. But of course, you have to do it before your results come out, not after that. PLAB 1, talking about the study resources, there are some online question banks like PLABable, then there are PLAB keys, and the GMC website also gives you some resources where you can go further and study. So each individual has different study pattern, study methodology. Some people are fine with one resource, but some people have to go through different resources and then they prepare for the exam. So depending upon whatever is your style, you can go ahead with one resource or multiple resources. The online question bank, they do cost you a few pounds or Pakistani rupees, like 50,000 to 1 lakh, depending upon which resource you are taking. The results comes after 6 weeks, and congratulations, you have passed your PLAB 1 exam. Now let's book for the PLAB 2 exam. PLAB 2 exam is actual presentation of how you are going to deal with the patients while working in the NHS. So it is, again, a 3-hour exam with 16 scenario-based questions, 2 rest stations, and each station is 8 minutes. So you stand outside a room and you read the scenario. You go inside this patient or patient relative, you talk to them, you ask their concern, you communicate what your management plan will be. And there is an examiner sitting there who assesses you in different domains, like what's your clinical skills, how are your communication skills, and then depending upon that, they give you the marks. Again, you have only 5 attempts to pass the PLAB 2 exam, after which you cannot sit for this. PLAB 2 happens only in Manchester, United Kingdom, not anywhere else. So you have to travel to the United Kingdom to give this exam. Again, no rechecking is available, but yes, you can appeal if there have been any administrative or any ethical problems while you were performing for the exam before your results come up. After the PLAB 2, when you have passed, you again have 2 years to go further for GMC registration, which give you basically a full registration and a license that you are safe to practice in the NHS. Let's talk about some finances. I have literally left it very empty, but it's a very detailed topic and one of the very important topic, especially when people from our country where the economic difference, currency difference is a lot, we have to consider which international exams we have to go in terms of our finances. I cannot mention all the finances because, of course, they vary from time to time. But basically, the English language exam costs you 1.5 lakh, like OET, 1.5 lakh Pakistani rupees, and IELTS is roughly half the cost of OET. PLAB 1 is again 1 lakh Pakistani rupees. PLAB 2 is about 3.5 lakh rupees. And then apart from all these expenses, you have to consider your travel cost, your accommodation cost, your visa cost, and if you are taking any online courses, any academies, then of course you have to pay for them as well. But relax, because these things are not coming all of a sudden. These come slowly. You have the time to do your savings and then pay for the exams and go ahead. All right. So now moving on towards, you are in United Kingdom, you have given exam, you're waiting for the results. Your circumstances allows you to stay in United Kingdom for some time. So what you can do there? You can go for an attachment. It's similar to the observership which students do in USMLE. And most of the attachments, they are free in NHS. So you apply for the attachments, you go to the hospitals, you check how the NHS is working and whether it actually suits you or not. And during your attachment, you can also go for an audit, which is again free of cost. And there are some courses like Advanced Life Support course, which you can do. These are not mandatory, but of course they enhance your CV and they help you in securing a good job as soon as possible. This was the PLAB route. We have some alternative routes to get the membership, which is depending upon which field you want to go. For example, if you want to go in surgery, you can do MRCS. You can do MRCP if you're in medicine, MRCOG if you're in gynae, and then get the membership and a license to practice. Then there is an MTI route for the people who are doing training here. They go through CPSP and go for some time in the United Kingdom, and they do their do experience how the NHS work and enhance their CV. The training pathways will be covered in detail by my colleague, Dr. Sheikh, but I just like to mention here that there are two main pathways in the NHS. One is the CCT pathway, which is formal training pathway. You give exam, you give interview, and you can go into the training. You pass few years and get the degree. But there is another pathway which is Caesar. My home circumstances, my family circumstances, for example, doesn't allow me that I go into the proper training pathway. So I will get my competences signed according to my own time frame. I'll show them that I have the same competences as expected from a trainee, and they will give me the degree for that you are a consultant. And those two consultants, both CCT pathway and Caesar pathway, have equal pay, equal respect, and equal knowledge. That's the beauty. You can do your specialization in your own time. Let's talk about life in journal in UK and the salary, because of course that is one of the factor playing an important role in our life. So usually the take-home salary for a non-training new doctor is 3,500 to 4,500 pounds take-home after tax deduction. You have a study budget of about 500 to 800 pounds annually, which you can utilize, take from the trust, do your courses, workshops, and they allow you and they don't ask you to return them. Then relocation allowance, because you are going from Pakistan to United Kingdom and you are settling there. Most of the trusts, depending upon your contract with them, they offer you 2,000 to 4,000 pounds allowance to get settled there. The working hours are 40 hours per week, which is quite good, reasonable number of hours. But apart from this hours, if you are still not managing, you can apply for less than full time, which is up to 50%. A non-training doctor can apply up to 50% less than full time, and most of the trusts, they do support it. You are eligible for 27 annual paid leaves, plus bank holidays, plus unlimited sick/carer leaves, plus paid maternity leaves for 1 year if you have worked with NHS for some time. The cost of living is also much lower than other developed countries, and there is free health and education for your family. This is quite interesting and deep topic, and if you like to dig further into it, we have Dr. Qasid Ahmad with us. But I like to warn you if you have already passed other international medical exams, because after listening to him, you would like to switch from other exams to the United Kingdom pathway. All right. The last slide is if you are not yet graduated and you are still in your, let's suppose, third year medical college or fourth year medical college, what you can do to enhance your CV. So decide about your career goals, what you want to do, and as our colleagues from USMLE pathway, they have told that you can further do your research work, your publication, especially as a first author. The number of researchers doesn't matter, but being the first author in one or two research matters most in NHS. You can present your work at national or international levels, do some audits, teaching courses, do some teachings with feedbacks, maintain your logbooks, take the opportunity to participate in your medical college societies, which will give you the leadership and teamwork opportunities. And do not forget to get the certificates of whatever you are doing, because that's the proof that you have done something, and that's also a memory. That was all from my side. But before leaving the stage, I would like to mention one thing, which is I pray that you all succeed in your life. But wherever you go, don't forget that whoever you are, wherever you are because of your home country, your own medical school, and your teachers. So wherever you go, keep your own home country the top priority in your heart, and everything else comes afterward. Thank you.
I would now like to invite Dr. Nukhaiz Sheikh. He's actually joining us online from the United Kingdom. Please unmute yourself, Dr. Nukhaiz.
Hello everyone, this is Dr. Nukhaiz, Sheikh. Assalamu alaikum. Am I audible to all of you?
Yes.
Can you hear me?
Yep.
Okay, that's great. Hi, I'm Dr. Sheikh, one of the doctors and working currently in the Southampton General Hospital, and I'm currently working in internal medicine department. As of now, I'm in Pakistan. Just came back, just landed here in Pakistan, and I'll be joining you guys physically there in a couple of hours. Currently, I'm at home, and I just joined there online. So before I begin, I would like to thank Dr. Fizzah and Dr. Qasid for such a detailed introductory lecture on how PLAB is so important for joining the UK pathway, and there are a lot of other pathways that you can go through to join the UK training. And if they are if you don't join the UK training, there are a lot of other pathways that you can work on, and you can join the NHS system, you can join the medical life in UK being as a non-training doctor. And I do know a lot of people who are working as a non-training doctor in the UK. So it's more like you can be part of NHS. It doesn't mean that you are lagging behind. The thing that I like about the UK culture most is there's no sense of competition. No one's in a rush there. No one's in a hurry, and they don't care if you have become a consultant at the age of 35 or maybe 55. So there's one more thing that I would like to add in Dr. Fizzah's lecture is it's quite balanced life there. You get to enjoy your life. You are in no hurry. There's no competition. No one even knows that you are a trainee or you are a non-training doctor. They all treat you with equal respect. They all give you equal amount of opportunities, equal job works, and equal there's no difference, and no one can even tell with with how you are working and with whom you are working that you are non-training doctor or training doctor. So that's kind of a it's very personal to you that you are in the training pathway or not, but it's always better to join the training pathway as soon as possible. I like to keep it short because I've been told that we are really short of time. Let me first tell about myself, how I passed PLAB and what did I do. And actually, I managed to have this job and secure this job within 1 month of passing PLAB too. So I think I did some things that a lot of the colleagues or a lot of the juniors don't really focus much on. They just focus on ALS or maybe focus on just PLAB pathway, and they don't usually go dig deeper that there are a lot of other things that you need to do. You might have heard that MLE is always a better pathway because there's not as much saturation as in the UK, but let me tell you that there's no real oversaturation here. Still, there are, even in my department, we are looking for more doctors, but they are not even, as competent doctors as they're looking for. Their demand is high, their doctor shortage is very high, but still, a lot of people, a lot of GMC doctors are there who are still registered for more than 2 years, and they are still struggling to get a job there. So there must be something that maybe you are lacking, and you need to ask your seniors who are already working there. Because personally, when I had my interview, I didn't even prepare for it. My CV was speaking for me. I didn't have to tell my interviewers that what I have done in my life, how I am currently doing, and what I'm looking for, how am I the best suitable person for this job. So it's your CV that works for you, and you should work for your CV. And to be honest, whatever I earned and during my house job, whatever I earned during my membership, I literally just put all of my money in my CV. I did like tens of courses, certifications, and I did a lot of stuff that I know most of the people won't be even aware of. I didn't have anyone in the UK, so I did all my research using YouTube, using Google, because during this modern life, I don't believe you need maybe even one or two mentors. You do need some mentors if they are physically present there, because I don't have any connections in the UK. So I used virtual mentors, including YouTube, Google. So it worked really well. So don't worry if you are an introvert like me, or if you don't know how to communicate with the people. I learned with time. You will learn too. Just don't sit back. Keep working on your CV, and I'm really hopeful you will be joining the UK soon if you keep working on the CV. In this lecture, in these slides, I'll try to go through each and everything that you need to work on to secure a job in the NHS. It can be a non-training job. It can be a training job, like I said. So can you please switch the slide? So let's imagine you have passed PLAB 2, you are in the UK, you have got your GMC registration, and you are currently doing the attachment there. So during attachment, you need to make sure that you literally are selling yourself. You are not there just to make yourself present there, like you are just being there just for the sake of it. You are just completing your 4 weeks, or maybe you are just completing your 1 or 2 months there. You are there to sell yourself. You are there to prove yourself that you are born to work here with NHS. You need to sell yourself. If you are really passionate about this thing, I'm sure you can secure your job. So the question is, how do you actually sell yourself? The best thing to do is, when you are in Pakistan doing your house job, or maybe when you are in Pakistan doing your membership after your house job, get your trust form signed by your consultants, or by your associate professor, by your professors, by registrars. All of them can sign your trust form, and you just need to work under them for just 3 months. So you are rotating in 4 rotations during your house job. You can get 4 consultants or 4 registrars to sign your trust form. That's really good. And you can just Google trust form 2025. You can download it, print it out, and sign it. You can take that trust form to the UK even before your GMC registration. During your attachment, you can show your consultants there that you are competent enough to do the hands-on job here. You are not here to just observe. You have observed during your house job. Now you can do hands-on work. So make sure that you let your consultants and all the registrars and all the seniors know there that you know how to cannulate, you do know how to catheterize or pass the NG, or how to communicate with the patients, or how to take consents. These are the basic things that in Pakistan we take it very lightly, but in the UK they think of all these processes as the backbone of the community, of the medical community, because we, being the resident doctors, are literally making the backbone of NHS, and they are dependent on us. They need us. So they are looking for us. So you need to sell yourself. Why me, and why each and every one? So in terms of understanding the NHS job roles, there are non-training roles and training roles. Before I further dig into this, I'll suggest you go for the non-training roles, because I know people who went for the training roles and they were struggling there, because it's quite different as compared to Pakistan, because there are culture barriers, language barriers, communication barriers. Even there are a lot of medical procedures that the people are doing there. They are quite different from the ones that we learned there and we got ourselves signed by the consultants here, but they don't really accept it there. So you need to go for non-trained roles to maybe learn their culture, to learn to communicate with them, because the people there, they can be very sweet to your faces, but once they are out of the hospital, I'm talking about the patients, they can even lodge complaint against you, and they can take you to the court just because you are not communicating well. Maybe you missed some points. So if you are in training pathway, your whole training pathway can be sabotaged by that. But if you are in non-training pathway, you can be just given 1 or 2 warning signs, and you can continue with your non-training job and maybe join training job after that. So it's better and it's safer to join non-training roles that includes F2, F3, and many of the colleagues would like to join F1. It doesn't matter at what level you are joining. Make sure that you do at least 6 months to 1 year of non-training role in UK before joining the training role. In terms of training role, there are 2 pathways, as mentioned by Dr. Fizzah: CCT pathway and Caesar pathway. For CCT pathway, there's this website, Oriel. You can apply for different training pathways, including psychiatry, neurosurgery, OBS and gynae, radiology, and even GP training. And you need to sit an exam called MSRA. It's free exam. You don't need to pay even a penny for this exam. So it's very cost friendly. It's very doable. You just need to have basic knowledge. Whatever you read in your final year or 4th year, it's basically that. And of course, there are a few subscriptions that you need to take to sit this exam. It's very cost friendly. And there's for IMT pathway, that's internal medicine training pathway, there's not even an exam. You just need to just sit in interview, prove your worth, and let everyone know how you are the best of all the candidates to join the training pathway. That's IMT pathway. It's quite competitive, but it's not it's not oversaturated. It's very doable thing if you have worked on your CV. So for joining the non-training or training roles, the CV includes doing courses. Dr. Fiz already mentioned ALS, but what I personally did was I did 3 courses from the UK, which included ECG courses, radiology courses, venipuncture courses. There are a lot of other courses include lumbar puncture, ABG, all the hands-on courses. They don't accept even from USA, not from Canada, not from any other European country. They just accept their own courses as well. So for, in the budgeting thing, you need to add around 700 to 2,000 pounds for these courses, because ALS can cost you around 600 to 900 pounds. And if you do a couple of other courses, they can cost you around 1,000 pounds more above that 700. So make sure that you have enough budget. If you don't, you can ask one of us. I personally, currently, I am mentoring 2 or 3 of my juniors uh, who will be joining UK soon, hopefully. And they asked me if they can use my card to pay their exam fee, and they paid using my card. And I asked them to pay me whenever they are feasible. So they pay me literally 50,000 per month, and it's very feasible. They paid using my card. It was around 10 lakhs Pakistani rupee. So it was very hard for them. I offered them, you can pay me 50,000 per month. So it's very doable. Being an American family, and thanks to Dr. Ahmad to allow us to come under one umbrella. And because I was working with my juniors, it gives you more opportunity to, give back to the community. And I'm willing to do it more than before, that I would have a lot of people with me. You can come to any one of us, and literally all of us will be more than happy to see you in the UK, to see you achieve your goals. We'll be more than happy for that. So make sure you work on your CV, join on training role for maybe 6 months to 12 months, and then apply for the training roles. Give your interview, take the exam if you need to join GP training or some other specialty training. Hopefully within 1 year, you will be joining the training pathway. Next slide, please. So next question is where to find the NHS jobs. You can take a screenshot if you are on your mobiles. You can click the pictures if you are in the auditorium or the lecture theatre. These are a few resources that you can use to apply for the NHS jobs. There are 4 states in United Kingdom: England, Scotland, Wales, Northern Ireland. It's very hard to get job in Wales because there are a lot of people who speak other languages there besides English. So maybe you won't be able to get it won't be very easy for you to find a job in Wales. So you need to focus on Scotland, England, and Northern Ireland first before you start applying for Wales. If there are no jobs available on 3 other states, you can go for Wales, of course. So these are the websites. You can use LinkedIn, you can use social media, you can even visit the websites of all the NHS trusts and apply directly from there. Or you can even email us or message us, or maybe email one of us, and we will help you tell where are their job openings so you can apply there. Because once we are in some trust, we usually know when there will be job openings and what they are looking for. We are physically present there. I can have a chat with the consultants who will be interviewers, and I can dig in what they are looking for in the upcoming residents. So we can help you with that. So it's really good if you try to communicate with us. If not, you can just drop an email, or maybe just watch some YouTube videos or talk to your seniors, whatever is easy for you. Just don't sit back, keep working on the CV and keep communicating. Communication is the key to success, I would say. And recruitment agencies also there who can help you find the job, but it's not recommended because recruitment agencies usually take around 45% of your pay. Up to 45%. It can vary between 10% to 45%. So you would literally be hands to mouth if you are coming with recruitment agencies. If you do come under recruitment agencies, try to resign from them as soon as you come to the UK. Try to give them notice that you will be resigning from them in 3 months. So you can be free, you can do your own work, you can have all your money for yourself. If you do have all your money for yourself, hopefully you will be able to help other people, other juniors, maybe colleagues or even seniors to join your pathway, or maybe you will be able to help them to come to the UK, take exams, and give interviews. It will be really beneficial for you and for your community. So it's beneficial if you do join NHS as an independent candidate. Next slide, please. The major question, as I was mentioning, recruitment agencies are not recommended because it's kind of an employer preference that you are not coming under recruitment agencies, because recruitment agencies tend to charge from the employer too, that that they're providing them doctors. So the employer is not literally keen to go with the recruitment agencies. They are keen to look for independent candidates on Track, Jobs.Scotland, NHSjobs.com, and other websites that I previously mentioned. So it can be helpful in securing an urgent vacancy or securing an urgent job, but it's not very recommended. Next slide, please. How to apply for the NHS jobs? As I mentioned previously, there are these websites. You need to sign up on these websites, search for the suitable roles, as mentioned, FY2, FY3, clinical fellow, research fellow, developmental fellow, all these non-training jobs. You just need to search these there and you will be able to secure the jobs. Use keywords from the job descriptions. In these job, there will be description that you will be joining the job, and you can look for those jobs and mention the job description as in the search tool. You will be able to find most of your job for yourself. So it's really good. Next slide, please. In NHS job application, make sure you fill each and every detail of yourself in personal details. A lot of people don't write the full name. It would be rejected as soon as they see your passport, and it's not, it's not as similar to your passport. They will be rejecting it. Your GMC registration number should be correct. Employment history should be relevant, and it should be correct. No lies. If you are putting out any lie there, they would simply be rejecting you, and they would be banning you from applying for the future purposes. So make sure you don't lie. You just sell yourself, whatever truth is, and do the quality, do the courses there, do the quality improvement projects in Pakistan, do the audits in Pakistan, and whatever you can do in Pakistan, go for it. So you can add it in CV. Once you go to the UK, you do the courses there as well. Just invest as much as you can do in your CV and put each and everything that you have done in the online CV. That's really beneficial. Next slide, please. So in supporting application, in supporting information, this is the part where you sell yourself. Everyone can write all other parts of the CV, but this is the part where you need to sell yourself. So once you have gone through the job description, make sure you address all the job specifications there. You need to sell yourself. Why are you the best candidate for this post? Use STAR technique, and you can always use STAR technique to sell yourself, to put out your to put out your good impression out of in front of the recruiters, in front of the consultants during your interview. And do highlight the voluntary experience, because there's no voluntary experience section in the CV. So in the supporting section, you can always make another paragraph where you will be selling yourself that you did this voluntary experience and you are interested in carrying forward this voluntary experience in the UK too. There's not much voluntary experience in the UK, but it does expose or does reflect that you are willing to do anything for the community, even if it's not paying you back. So that's a good opportunity, and it does reflect that you are a good human being, that they are looking for a safe and good doctor. So that does reflect these qualities. Next slide, please. References is the most important part of the CV after supporting information. I had 2 references from the UK consultants that I tried to gather during my clinical attachment there. I had clinical attachment of 4 weeks in Redditch. They charged me £50 at that time, but currently they are charging £1,200. So attachment is not free as of now during these days. They have started charging because a lot of people are applying for the clinical attachments. So they are just they are just charging you for each and every step, for each and everything that you will be doing in the UK. So that's another thing that will be additive there for attachment. Make sure that you have at least 500 to £1,000 saved in your budget. Maybe you will be able to find a couple of free attachments too, but most of the NHS trusts, it's in the policy now that they won't be allowing any unpaid clinical attachment anymore. So they are charging money for it. So only the serious candidates, or maybe I'm not sure what the reason is, but they are just filtering out some people that only the serious candidates would be applying for the attachment. So it's really good you do the attachment. So make sure you use that attachment for your benefit. Ask the consultants that you can use their references. You can ask for their emails. You can even email your CV to them that you have passed a PLAB, you have done these courses in the UK. Currently, you are doing attachment in their trust. And whenever there's an opening in their trust, they can maybe refer you to the HR department or refer you to the interviewers panel. It can be proven, beneficial for you. So don't leave any stone unturned while you are applying for the jobs. Next slide, please. So summarizing my presentation here, giving you final tips: apply early and stay persistent. Whenever you are applying, there will be a filter at the top of each website that would say show the newest jobs in the beginning. So turn that filter on, apply on the newest jobs first, so your name comes on top, because once their quota is filled, they can be turning that job off in a couple of hours or maybe in 30 minutes. So make sure you apply as soon as possible, so there's higher chance for you to get selected for that job. Network with the IMGs, that's literally us working for you in the UK, USA, Australia, or anywhere, and you are moving to that country. Make sure you network with us. We are there to help you. We are here to facilitate you. Don't hesitate, just network, communicate with us and with all the NHS professionals, find their emails through the NHS Trust websites, and network, and communicate. Stay updated on GMC guidelines and NHS policies. You can visit their websites, do orders, quality improvement projects, some courses, get your crest form signed by your consultants, by your professors. Do all of these things in your home country, and I'm hopeful, and inshallah you will be securing your job, your first job in NHS very soon if you follow all these steps. Best of luck to each and every one of you. Don't sit back, don't lose hope. Whatever pathway you are on, just keep working on it. Inshallah, things will be in your best favor. Thank you for your time.
Thank you, Nukhaiz. Thank you, Dr. Fizzah. And this is a mute. Okay. मेरा नाम कासिद अहमद बाजवा है और हमने इस शॉर्ट से टाइम में कोशिश की है कि यूके पाथवे का एक ओवरव्यू आपको दे दें ताकि एक अंडरस्टैंडिंग डेवलप हो। मजीद रिसर्च आप कर सकते हैं, उसके लिए आपके पास रिसोर्सेज हैं, यूट्यूब है और हम अवेलेबल हैं। आप मेरा कॉन्टैक्ट इंतज़ामिया से ले सकते हैं, फेसबुक पे मेरा नाम सर्च करें, मैसेंजर पे आएँ। आई अप्रिशिएट अपना थोड़ा सा तारुफ करवाएं और उसके बाद आप क्वेश्चंस करें, इंटरेक्ट करें। आई एम हैप्पी टू हेल्प। बात यह कि मैं जल्दी से कुछ सवाल जो गूगल फॉर्म की सूरत में लोगों ने मुझसे पूछे थे, स्टूडेंट्स ने इंटरेस्ट शो किया था, सिर्फ उनका जवाब दूंगा और उसके बाद अगले सेशन की तरफ टीम जाएगी। मुझसे पहला सवाल किया गया था कि विच कंट्री इज बेस्ट फॉर नाउ टू स्टडी। इसके लिए मेरा हमेशा से ये एक एडवाइस होती है कि आप इंफॉर्म डिसीजन लें। जब मैंने फैसला किया, मैंने सारे ग्लोबल पाथवेज को एक्सप्लोर किया, यूएस, ऑस्ट्रेलिया, आयरलैंड, न्यूजीलैंड, पाकिस्तान, और आई चोज यूके। और अगर मुझे दोबारा ऑप्शन मिले, आई शैल चूज यूके। तो वो मेरी चॉइस थी। हर पाथवे के प्रोज एंड कॉन्स हैं, आपने अपनी रिसर्च खुद लाजमी करनी है और सारे पाथवेज को कंपेयर करके आपने अपना डिसीजन लेना है। और नेक्स्ट क्वेश्चन है हाउ टू प्रिपेयर एंड द बेस्ट रूट टू टेक, पॉसिबल ऑप्शन, ऑलरेडी एक्सप्लेन बाय डॉक्टर फिजा। सजेशन ये है कि अगर आप अभी स्टूडेंट लाइफ में हैं या फ्रेश ग्रेजुएट हैं तो गो फॉर प्लैब रूट, और अगर आपके 2-3 साल हो गए हैं या आप किसी ट्रेनिंग रूट में हैं देन गो फॉर मेंबरशिप एग्जाम्स या एमटीआई। तो देन यू विल बी मोर कॉन्फिडेंट और आप मिडिल ग्रेड जॉब पे, जो रजिस्ट्रार लेवल जॉब है, वो ज्वाइन कर सकते हैं यूके में, जो आपको बेटर सैलरी पे करेगी। बट मेक श्योर दैट यू आर कॉन्फिडेंट इनफ इन दैट स्पेशलिटी, अदरवाइज यू विल बी अनसेफ फॉर पेशेंट एंड यू विल मेक डिफिकल्ट डिसीजंस फॉर यू एंड पेशेंट्स। फिर नेक्स्ट क्वेश्चन है हाउ मच डीपली शुड आई स्टडी फॉर इट। You are responsible for patient safety. You need to work hard and study deeply. Total expenses and time. For every exam, as we discussed, I give a rough timeline of 3 to 6 months. 3 से 6 महीने आप एक एग्जाम के लिए डेडिकेटेड तैयारी करें। आपके अपने हिसाब से टाइम ज्यादा या कम हो सकता है। टोटल एक्सपेंस प्लैब ग्रुप के लिए कम से कम 5,000 पाउंड और एवरेज 5 to 10,000 पाउंड आपने टारगेट करना है। इससे कम में आप अपने लिए मुश्किलात पैदा करेंगे, फिर आपको इंतजार करना पड़ेगा, तो ज्यादा महंगा और ज्यादा मुश्किल होता है। ठीक है। नेक्स्ट क्वेश्चन है यूके रेजिडेंसी एज वी ऑल नो इज वेरी टाइम टेकिंग, डज इट वर्थ इट। बिल्कुल, अगर आपको यूके पसंद है, आपको यूके सूट करता है, तो बिल्कुल ये वर्थ इट है एंड यू गेट वैल्यूड फॉर दैट। विच इज बेटर, यूके और यूएसए? मेरे लिए यूके, मेरे भाई अहमद फराज के लिए यूएसए। अपना फैसला आपने खुद करना है। प्लैब में सैचुरेशन का कहा जाता है, तो उसके बारे में क्या ख्याल है, ये मैं जरूर जिक्र करूंगा जल्दी से। बिल्कुल सैचुरेशन है, और हमसे कुछ सीनियर्स ने ये सोचा कि शायद यूके पाथवे इजी है तो यूके पाथवे में चले जाएं। अब ऐसा नहीं, उतनी ही मेहनत उतना ही खर्चा आपने यूके पाथवे में भी करना है जितना यूएसए में करना है। तो यू नीड टू चूज, इफ यू प्रेफर यूके देन गो फॉर इट। और लास्ट पॉइंट जो मैं इधर मेंशन करना चाहूंगा कि यूके इज द ओनली कंट्री इन द वर्ल्ड दैट वेज यू इक्वली। आपकी वेटेज इक्वल होती है जब आप ट्रेनिंग अप्लाई करते हैं उनके अपने ग्रेजुएट से इंटरनेशनल ग्रेजुएट्स की। आपको ओपन मेरिट पे जज किया जाता है, वो अपने कोई प्रेफर नहीं करते अपने ग्रेजुएट्स को आप पे इस टाइम तक। ऑल्दो देयर इज टॉक गोइंग ऑन के नेक्स्ट ईयर से शायद वो प्रेफर करें ब्रिटिश ग्रेजुएट्स को ओवर इंटरनेशनल ग्रेजुएट्स। But the thing I like about the UK is equality and diversity, and that's what we cherish here. Thank you so much.